Hi, I'm Dr. Lisa Cassileth, and I'm here to talk to you today about breast augmentation. So there's many different issues that you have to decide before undergoing breast augmentation. So first we're going to talk about just size. How big do you know where you want to go? Do you want to be huge? You don't want to wake up with double, triple D Dolly Partons from an A, nor do you want to wake up with, well, why did I bother? So how do you determine what the right size is? And I think for this, it's really, many people get on websites and look. The only problem with this is that you really have to match your body type. So the same size implants on a tiny person is obviously a totally different size than someone who's a larger person. And I really think the best thing is like trying on implants. So for my patients, I have them come in and actually take implants that are already been formed, just made for patients to slip under their bra without a padded bra and try on at the office. So when you go to see your plastic surgeon, make sure you bring a bra with no padding and be prepared to kind of look with your girlfriends and say, hey, does this look right? This is what I'm looking for. One word of warning though is the size that you try on is often going to be a little bit smaller once it's in you because your body will compress it and kind of hold it against your chest wall more. So if you're between two sizes, pick the bigger size. Some plastic surgeons also have a machine called a Vectra. A Vectra allows a three-dimensional photograph to be taken of your breast. Those things are very helpful because then you can actually tell the machine, hey, I'm looking at a 300cc implant and does this look good? And it'll show you a model of yourself with that size. And I think that's probably the most reliable form. There are two options of where to put breast implants. These are either submuscular, that means under the pectoral muscle, or subglandular, that means right behind the breast tissue but in front of the muscle. I tend to prefer submuscular. Why? Because right off the bat, the implant looks more real. Why? Because the muscle hides and naturalizes the top surface of the implant. And then more important, over time, the longevity, the muscle seems to act as a bra holding the implant against the chest wall. And what this does is it holds the implant up over time and it stops the breast from kind of having that extra bulk, the extra weight of the implant, which weighs it down and makes it droop with age. Another part of the decision is where the incision is going to be. So lately, maybe in the last 5-10 years, it's really been much more popularized to do them transumbilical. That means through the belly button. I have some patients coming in saying they want them axillary, which is through the armpit. And there's restrictions to every type of incision. I find in my practice I almost always use the areolar incision. Why? Because you can put in any type of implant through this incision, silicone or saline. And because it's such a neat edge, on some people they'll pigment a little bit pink or a little bit brown, which happens to exactly match the areola. So it's such a well hidden scar and almost near impossible to see later that I think it's the best choice for most people.